Welcome to the Community Health Hero Show, where we spotlight local organizations that provide much needed health and wellness resources and information so that everyone in our community can strive to live healthier, happier, and longer lives. I'm Dr. Penny Walker, Senior Medical Director for Unite Healthcare Southeast Region. Thanks for joining us. Today on Community Health Heroes, we'll be speaking with Lisa Romback and Chantrelle Varnado-Johnson of the National Alliance for Mental Illness, who will talk about the current state of mental health access in our community and how to prevent holiday stress. Later, we'll be re-airing one of our favorite Eat Fit NOLA cooking segments. And in recognition of Safe Toys and Gifts Month, a special encore presentation on how to keep your kids safe during the holiday season. So don't go away, we'll be right back with more Community Health Heroes.
Getting closer to nature can get you closer to your family. Go to discovertheforest.org.
Welcome to Community Health Heroes. Did you know that 1 in 5 adults in America experience mental illness? Join us today to talk about the current state of mental health access in the greater New Orleans community and what you can do to avoid holiday stress. Our Executive Director, Lisa Romback, and Board Member and Licensed Counselor, Chantrelle Varnado-Johnson of the National Alliance for Mental Illness. Thank you both for joining us today.
Thank you.
Thank you.
So can you tell me a little bit about NAMI?
Sure. NAMI is the National Alliance on Mental Illness. We are with NAMI New Orleans, so we're the local affiliate. We're located at 1538 Louisiana Avenue in New Orleans, and we also have a second location on 8th Street in Harvey on the West Bank. We offer education, advocacy, support, and services for individuals living with mental illness as well as their family members.
So what kind of age ranges do you offer services for?
We offer direct services for people who are adults aged 18 and over. However, we will assist families who have children living with mental illness, and we will also provide resources and information to individuals who are younger than the age of 18.
And what kind of information can you share with our audience about the stress that's related to the current events that are going on right now in our country?
Some of the things that I think people need to remember is to stick to a normal routine, be sure to see your healthcare providers as scheduled, talk about your concerns with those that you trust and that care about you, and make sure that you get plenty of rest. And if it's stressful and it triggers you, maybe to avoid certain topics, maybe just stating that this is a topic that I'm not really ready to talk about right now, or I think I've just had dinner, so I might go outside and take a short walk. That might be a way for people to avoid getting into maybe a debate or a direct conversation when people's ideas maybe are very different.
And then speaking of the holidays, there's a tremendous amount of stress with, shopping, family, travel. What kind of suggestions can you offer our audience with regards to the holiday and stress?
Well, I think Chantrelle has a few tips and strategies for families.
To begin with, one of the things that I would recommend is for family members to be able to take their rest. And what I mean by taking the rest is the R is for setting reasonable expectations, the E is for exercising, S is for simplistic task, and then also the T is for to be able to take time for yourself.
So can you expand on each one of those?
All right, so starting with reasonable expectations, not going outside of your budget. So making sure that you stick to your normal spending habits. In addition to that, remembering what this holiday season is about.
Oh, that's a great point. And how about the E?
Okay, the E with exercising, even if it's just taking a 20-minute walk, or as far as your normal daily exercise routine, not to abandon that for the holiday season.
And the S?
Simplistic task, having your goals and being able to stick to them and making sure that they're smart, specific, measurable, achievable, realistic, and time-oriented.
Awesome. And then the T, I think, was that time?
Yes, taking time. So being able to take time for yourself, being able to have like mindfulness activities, or even just being able to breathe.
Really kind of maybe even getting yourself away from the stress of the family and shopping and all that
Yes.
excitement. Awesome.
Yes.
And then I think, Chantrelle, you're also very good about helping with children. What kind of tips can you give us about children in the holidays and children in stress?
Okay, well, some tips that I can definitely give as far as working with children during the holidays is making sure that you remove items that may be overly stimulating from the child's environment. In addition to that, making sure that you're checking in with your child, seeing, what they're thinking, what they're feeling, and being able to explore their reactions.
Especially during the holidays, they're used to getting up, going to school, having
Yes.
homework, and now suddenly they have hours and hours in the day where they don't know what to do.
Well, what parents can do is continue with various different activities. So what I would recommend is perhaps limiting the TV time to about 2 hours. In addition to that, being able to do activities where it may be like using Legos or building blocks. In addition to that, perhaps doing crafts and making sure that the children do things in moderation.
Right. I mean, even like they're used to their, breakfast at home, their school lunch and
Yes.
dinner, so kind of keep that routine going
Yes,
as much as you can with the stress of the holidays.
yes.
All right. And then we were going to also talk, Lisa, about what kind of signs and symptoms, sometimes people don't even know they're stressed until they can't sleep or they can't eat. So what kind of signs and symptoms should we be aware of?
So it could be things like disruption in your normal sleep patterns, feeling more anxious than usual. And then there's some more obvious signs like crying or actually feeling depressed or sad, but making sure that you acknowledge those feelings and then address those feelings in a way that's appropriate for the level where you are. I often recommend not reinventing the wheel, so if you have a relationship with a primary care doctor, that's a good place to start. Make an appointment, go in, talk with your primary care doctor. And often when people see their primary care doctors, they actually talk about their physical symptoms, which may actually be related to something that's mental health related. But they'll talk about the fact that they're feeling achy or that they're not sleeping, and they often don't address the fact that maybe their mood hasn't been correct. So it's incumbent upon the individual to address that with their doctor, but it's also incumbent upon healthcare providers to ask the questions.
Right.
Because if they ask the questions, people generally will respond, and then you can find an appropriate course of action.
And what kind of services does NAMI offer for people that are stressed or depressed, especially this time of year?
For families, we offer 3 monthly family support groups in various areas around the city. We also offer education programs for family members and people living with mental illness. These are 10 and 12-week courses that you can actually come in and take. One's called Family to Family. It's for family members. It's a curriculum, and each week covers a different topic about helping your loved one who's living with a mental illness. The 10-week course is called Peer to Peer, and it's for individuals who live with mental illness. So these courses are really instrumental in helping people move forward in their recovery or helping their family member. In addition to that, we have a program that's pretty new. It's called the Mental Health Navigation Team. So if someone comes to us, we have a helpline coordinator who will actually answer the phone call or assist the person who walks in or respond to the email. If we have a service or support that can help that individual, we'll link them to it. If we don't have a service or support that's appropriate, then we will help them find what they need and help them navigate it. And what we found is that oftentimes people are in what we call a pre-crisis situation. I've run out of my medication, I can't get an appointment at my mental health center, I've made a phone call and I've been put on one of those automated lines that says press 1, hold here,
Right.
someone will call you back. And if you are in a pre-crisis
Right, that's not
situation,
helpful.
that might help you cross over into a full-blown crisis. So we will actually assist you with come in, sit down, we'll help you make the call. We'll help you secure the appointment. We'll help you figure out how to get your medications refilled. We'll help you figure out what type of provider you need based on your insurance that you have, because you can't just go anywhere and get any type of service.
And that's very confusing to our community. I mean, they don't know where to go. It gets frustrating, and they're already frustrated enough. So that's a great resource.
So one of the great things about affordable health care is that many people now have insurance, and then recently we've also had Medicaid expansion in the state of Louisiana. So many, many more people have health insurance coverage, but are still having difficulty accessing the appropriate care that they need.
And Lisa, like you mentioned, some of these people have never had insurance before, so they don't even know how it functions or works or how to even access care. So it's great that you have a resource that can help them navigate, like you mentioned, this very complicated system.
It is actual navigation, and as I mentioned earlier, helping people maybe connect to a primary care doctor might be the quickest and easiest way to go to begin with, and then from there, if they need a referral to a specialist like a psychiatrist, then their primary care doctor can help them do that.
Absolutely.
We're also offering something new called mental health first aid. And this is something that I'm very excited about. Chantrelle's taken the course. And it's an 8-hour course that, much like basic first aid that most people take, it helps you to identify if someone is developing a crisis or is experiencing symptoms of mental illness or a substance use disorder, and helps you to offer the initial aid. So I think it's a fantastic course, and it's offered for people who interact primarily with adults, but there's also youth mental health first aid for individuals who primarily interact with children. We've recently received a grant, so we're offering the class for a very low cost right now, and if individuals are interested in signing up, we have waiting lists forming now.
Wow.
We think it'll be great for the community, and our goal is to train 250 people in the next year. There's nearly 1 million people certified in mental health first aid worldwide, so it is something that is starting to become very prevalent.
And this sounds like you guys have so many wonderful programs. How do we find more information out, especially our audience, if we want more information on your programs?
So I think the most comprehensive way to get information would be to go to our website, www.namineworleans.org, or you can call us at 504-896-2345. And I would encourage people, if you're ever in our neighborhood on Louisiana Avenue, because we've been there since 1999, we've actually been in business since 1978, you'll see the building and say, oh, it's been there this whole time, and now's the first time that I'm realizing this is where the facility is. So again, that's 504-896-2345 or www.namineworleans.org. We also have a way to contact us via email if you go to our website, so people can email us as well.
Well, thank you, ladies, for providing this extremely helpful information today. And thank you for being on our show.
It was a pleasure. Thanks for having us.
When we return, we will share a very special encore presentation on toy safety and recognition of Safe Toys and Gifts Month, followed by a re-airing of one of our favorite Eat Fit NOLA cooking segments. So be sure to stick around for more Community Health Heroes.
Sometimes life throws you something unexpected, but the Breeze Dream Foundation and United Way are giving both individuals and businesses a chance to help folks in our region. You can be the one to help those in need, weather their personal storms, both large and small. You can be the one to help others rebuild their lives and get back in the game. Because when you give, amazing things happen. So step up and be the next one.
Find out how you can help at thenextonesela.org.
Welcome back to Community Health Heroes. The holidays are upon us, and parents, grandparents, aunts, and uncles are shopping for that special toy for that special kid in their lives. But how do you know what's safe and age appropriate? Joining us today to talk about toy safety, especially during the holidays, is Dr. John Firestone, a pediatrician with Children's Hospital After Hours Clinic in Metairie. Welcome to the show, Dr. Firestone.
Thank you. Thank you for having me.
So even one death is too many. How do we know if a toy is safe for our children?
Well, the toy industry and the Consumer Products Safety Commission and community organizations like the American Academy of Pediatrics and many others have all combined to try to help parents make those choices, parents, aunts, uncles, grandparents, by putting information on all toys about what ages are appropriate, giving some hints about what might be appropriate to give to those children. But I think it's also important to note that this is a whole family project.
Right.
You have to involve the grandparents in understanding this. You have to involve the older siblings in understanding that toys that are appropriate for them might not be appropriate for a little brother and little sister.
Absolutely, that's a good point.
And in the whole, some injuries even happen in the opening, package opening process where you've got a lot of bustle,
Right.
a lot of things happening all at once, hard to supervise what's
Those
going on.
little clips that are on these toys.
Right. And, wrapping is sitting around and the plastic coverings, the bags that the toys come in can become aspiration problems, suffocation problems for
Right.
younger members of the family. So supervision, think about the toys ahead of time, supervision when the toys are being opened, teaching the child how to use the toy appropriately, making sure you involve the older siblings as monitors, and keeping an eye on what's going on all the time, whenever the kid's playing.
So it sounds like you need to throw the packaging away right away so that here we got these little plastic things on the back.
Right.
Okay.
All those things. It's hard on Christmas morning not to have a mad dash for the tree, and everyone enjoys the chaos and the enthusiasm, but maybe there needs to be some orderliness to that process.
Absolutely. So some parents think their little toddlers or their babies are very advanced and they want to buy a toy that is more for an older child. What do you suggest to them?
Well, of course, all of our children are above average, right? These recommendations on the packages come from lots of thought and lots of consideration, and what typically the child that age is likely to do with that toy, and things that they might do that, well, they don't know what the toy is for. We know what it's for.
Right.
That's why we have to teach them when we give them the toy. But there's all sorts of things that they may decide to do with it that are age appropriate, and even if your child's a little smarter or more mature, they're likely to be close to that developmental median.
Right.
And so I think you have to be careful about making those decisions. And it all goes back to thoughtfulness, knowing your child, and the child's temperament and all those sorts of things that go into making that the proper choice.
And what if your child is choking? What should you do?
I think it's a good idea for everyone who has children to contact your local Red Cross and take classes in CPR, and because involved in that also, it's not all about pumping on someone's chest,
Right,
as
absolutely.
you well know.
Right.
It's how to handle those situations where there's choking. How to teach those maneuvers over the television it would be a difficult thing.
Too much, right? It's too much,
But I
agree.
think that's a good idea for not just for Christmas time, but
All year.
from birth.
Right.
To be involved and be prepared for those emergencies.
Right, and probably our viewers don't know, but when you do CPR and you learn how to do it, they teach you different things to do for different choking episodes.
Right.
So that's a great
Right.
suggestion.
The age of the child, there's a lot of things involved in that and learning those things. There's much, with your background, I'm sure you're familiar with the people have talked about Dr. Heimlich and his famous maneuver and the pros and cons of that. Well, it kind of comes down to knowing when to do it and when
Right.
not to, and knowing how to do it.
And it varies for children. Like a baby,
Right.
you would do differently if they were choking than an adult. So
Right.
a very good point. And tell me about bike helmets. How do you choose a proper bike helmet?
Well, there's some age guidelines on these too.
Okay.
But when you're talking about fit, this might not be easy to see with this on it. You want there to be, well, this is not going to, you want
I think
there to
it's for a
be
child.
about 2 fingers breadth
Space.
between the top of the brows and where the hat fits.
Okay.
And, you want to first bring the child with you, because they're going to have to choose to wear this. So it's got to be something they think looks cool.
Right.
So have them there, and then you can fit it on them.
Okay.
You want there to this Y to be under the ear
On both sides.
on both sides. This one is there. And when you snap it underneath, you want the child to be able to be able to open their
Okay.
mouth. So, like any other piece of clothing, you need to be there to be fitted. And primarily, I think, they got to think it's cool.
Absolutely, or
Or
they're not
they
going to
won't
wear it.
wear it.
Nope, that's right. Well, I thank you so much for being on our show today and providing this just valuable information for our audience.
Well, thank you. All of these items, these things we're talked about, can be expanded on by looking at safekids.org,
Safekids.org.
the Consumer Product Safety Commission, and the American Academy of Pediatrics website they all reference each other.
Okay.
But there's a lot of information there that I think people would find valuable.
Well, thank you very much for your time and answering these great questions.
Well, thank you.
All right.
Thanks for having me.
We'll be right back with more Community Health Heroes.
I'm Molly Kimball, registered dietitian with Oxnard's Elmwood Fitness Center. We've collaborated with more than 60 local restaurants to create Eat Fit NOLA, a partnership that highlights the better for you items right there on a restaurant's menu, making it effortless for you to dine at your favorite New Orleans restaurant without ditching your otherwise healthy diet. Every month, the Community Health Heroes Show will shine a spotlight on one of our city's incredible chefs who will show you how you can make healthier choices when dining at theirs or any of our city's great restaurants. So don't go away, Community Health Heroes will be right back.
How do we show our gratitude for our active duty military and veterans? The Disposable Heroes Project is a nonprofit organization serving all branches of the military and their families. Their mission is to recognize, honor, and support our veteran and active duty personnel in any form of assistance they may need. Visit dhproject.org now and donate or purchase merchandise to show your support. dhproject.org. It's your turn to serve.
Welcome back. Joining us for today's Eat Fit NOLA cooking segment is Liz Ford, founder of Root and Arrow, a meal delivery subscription service that directly delivers organic, fresh, clean, seasonal, and local when possible ingredients to nourish your mind, body, and soul. Thanks so much for joining us today on the show, Liz.
Thank you for having me.
So what are you preparing today?
Today I am preparing a watermelon feast.
And what is in this? Yummy, it already smells good.
Watermelon, it is zucchini, cucumber, strawberries, watermelon, avocado, a fresh lemon vinaigrette, and everything is topped with fresh mint.
And what is this cool little tool that you're using to make this?
This is my favorite tool. This is a spiralizer, and it takes anything and makes some vegetable noodles, which is really nice, a different texture, so it's not as chunky.
So you could either eat this raw, or if somebody wanted to, they could like gently steam them.
Correct.
Awesome.
Yes. Yeah.
And how did you come up with that name, Root and Arrow? It's such a different name.
So I knew what I wanted to do with the company before I started it, and I was struggling with the name, and I wanted plant-based nutrition delivered to you. And after a lot of thought, Root and Arrow came up to me. So Root is plant-based, and Arrow is delivered to you.
Awesome. And most of the items, or all the items, are Eat Fit NOLA?
All items are Eat Fit NOLA.
Awesome. And then this is vegan.
Yes.
And also, is there any
Gluten-free.
gluten in this?
No gluten at all. Everything is vegan, organic, and gluten-free.
And so if somebody was really interested, how many meals a day do you prepare for people, and how often do you deliver?
3 meals a day, breakfast, lunch, and dinner, and I deliver on Sunday mornings and Tuesdays.
And it's completely prepared for you. You don't have to do anything.
Yes, so everything is going to come in this container. All you have to do is dump it, shake it up, and enjoy.
And so the salad dressing, they're inside
Yes,
there?
they're in there.
Oh,
Down there
that's
at the
very
bottom.
cool. And how many items do you have on your menu at any given time?
15. So I do Monday through Friday, breakfast, lunch, and dinner. So everything's set, and you pick and choose which day and what combination of meals you want each day.
And you definitely have some breakfast items?
I do. So this right here is our raw cranberry muffins. People tend to really like the breakfast items, and they order actually quite a few of them.
So if you wanted to have like 2 servings, you could substitute
You
or
can.
say?
You can't do that per se through the website, but just give me a call or email me through the website, and I'll take care of it.
And how long have you been partnering with Eat Fit NOLA?
About 7 months.
Wow, okay.
So I'm adding just a little bit of salt to a freshly squeezed lemon and olive oil, and then a little bit of garlic because it'll kick up the flavor. Shake it up, and then we're almost done.
Awesome. It looks very fresh and very colorful. I'm gonna just move this out of the way so
Thank you.
our audience can see this beautiful salad.
And then there you go.
And then every quarter you change the menu up based on what's available?
Every season we change the menu with seasonal items. That's how we can focus on that. That being said, we do change our menu also every week, so people get a variety in their diets and they're not eating the same thing every week.
So you change your menu every week and then every
another
quarter.
overhaul every quarter.
Wow, that's fascinating. And how could we find out where to find your services?
www.routeandarrow.com. Or
Is it an and, like a
A&D, everything's spelled out.
Root and Arrow.
.com, yes. Or give us a call, 504-444-6504.
And what else do you have here for us?
So here I have our Mediterranean salad. It's greens, it has a Greek vinaigrette, and then a zucchini hummus. So some people have bean allergies, and I try to take it out sometimes. So that's with zucchini. It has quinoa, cucumber, sun-dried tomatoes, and olives. And then this right here is our Thai salad. It is kale with an almond butter dressing, and then it has curried cashews and raw carrots.
Ooh, tell me about the curried cashews. That sounds
The curried
delicious.
cashews, that's just fun. It's carrots, and you toss them in curry, green curry paste, cumin, and a few other spices, and just roast them in the oven. And they're good. They're perfect topping. And then we also have our raw cranberry muffins, which are our client's favorite. It's just an even amount of dried cranberries and dates to cashews and almonds, and then it has a little bit of citrus with orange and vanilla.
So you are getting your protein, like in the breakfast, you get your protein
You
through,
are.
like the cashews.
And because we don't have meat per se, we focus a lot on fats, so you're still full the entire day.
Awesome. And this diet is also, or these meals are also healthy for other things, like you were talking about earlier, like diabetes,
Yes.
cancer patients.
Yes, autoimmune diseases, people with diabetes to kind of help regulate the blood sugar, and then heart health, just overall eating more vegetables in general is going to be really helpful for them.
Great. So Liz, this is just a fascinating concept. How did you come up with this whole idea?
So I used to be an attorney. I would work long hours in the office, and I wanted a company that delivered fresh food to me and focused mainly on vegetables and organic food, and we didn't have it. And so I was actually let go from my job, and instead of worrying about anything like that, I decided I'm gonna use this opportunity to do exactly what I want in the city, because I love New Orleans, and I felt like it's a way that you can help the city and give back.
So there's definitely an opportunity. Nobody else was doing this.
No.
And you were telling me earlier before the show that you would bring these things to work.
Right, I would bring them to work, and people would ask me, what are you eating? And y'all need to try this, it is so good. It's just simply vegetables, and it's so easy and so fun what you can do with them.
So tell me about fresh and clean. There's a lot of ingredients that our population may or may not be familiar with, and you mentioned like quinoa and some other cool things. Tell me about that.
So fresh and clean basically means I make everything from scratch. If my dressings, I make everything from scratch. I start with the olive oil, add the citrus, add the vegetables, add the fruit. I just want to bring to people the cleanest ingredients I can, and fresh in that I buy my ingredients the day before I produce everything, and then I deliver right after I'm done producing. So it's the freshest, straight from the store, kind of to your house. And the cool thing about quinoa is it's naturally a gluten-free grain, so I don't have to worry about finding it gluten-free. It's a grain kind of like rice, except it has a lot more protein, and it's more balanced with the carbs to protein.
So you're not going to have the blood sugar shifts.
Right. It's great to help even out your blood sugar.
Awesome. Well, thank you so much for providing us food and this information for us today.
Of course. Thank you for having us.
And we'll be right back with more Community Health Heroes.
Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Thank you so much for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com, or visit our website at www.communityhealthheroes.org. You can also find our show on YouTube. We hope that the information we provided today and throughout the year has helped you and your family live healthier, happier, and longer lives. I'm Dr. Penny Walker, and we'll see you next time on Community Health Heroes.